Hello everybody, I'm going to do a short video today about myofascial cupping. Many of us have known for a long time about myofascial release using compression on the body through the use of a foam roller or even a pressure system that has rollers on it to be able to compress the tissue, lengthen out that fascia that surrounds the muscle and get release of those adhesion points. We can do the exact same thing, very similar thing, through cupping. Cupping works in a negative pressure system though, meaning that it creates more space underneath the tissue. So it's almost like taking my skin, pinching it up and creating space underneath it, like you would if you pulled up a sheet from a bed. That creates space, which also brings blood flow to the area and can do very similar things with breaking up those adhesions. You can even see as I'm kind of like tugging and wiggling a little bit, can have a really positive effect around bringing blood flow to the area, etc. Hasn't been a ton of research done on this in the Western medicine world, so I can't say without a doubt that this is a great method. However, clinically speaking, I've seen some great results on myself and with working with clients, as this is a fairly gentle way to also provide relief for people. So some things you can use, I like to use this in the shower. So I will often be found cupping different areas of my body with lots of lathery soap. I even use shampoo usually because it kind of really lathers up really nice on my skin. If I'm not in the shower, I'll just use massage oil. So this is like a grapeseed oil type massage oil. You can use coconut oil, even olive oil from your kitchen. And what we know is that it creates space, which helps also reduce scar tissue. So if you have a chronic scar that you've kind of worked for a long time, cupping could be a great way to help relieve that. Now, of course, if you're feeling like that scar is really tied down, you want some extra support, please go to a professional. But if you're willing to give this a try around supporting, relieving some of your tissue, I'm going to show you how this works now. So I've already put a little bit of oil on just to kind of get myself a little bit of a release, but you're going to just put a little bit of oil on. You want to make sure you have a good surface area to work with. So my forearms are often a place where people have a lot of tightness, especially with stretching those extensors. So what you're going to do is give the cup a squeeze. You're going to put it on your skin, and I like to put it so I make sure I have a good firm grip around all the points of skin around the circle of the cup, and then I'm going to just let it suction. So I'm going to let you even look close here. You can see it kind of suctioning up my skin, and if I straighten it, it pops off, right? So what you can do is just find a spot, see if you can get some good tension and hold it there to give some just pull from that cup. I'll also use it to actually slide and glide over the tissue. So I need a little bit more oil here, but you can see me able to just slide this down my forearm. And so I could even use a smaller cup for this surface area of skin. But the two places I've been using this the most, I should say three, have been my IT bands, lower calves, my core, actually my rib cage, and my lower back. So I'm just going to show you how this works for the core. So a lot of us have some adhesions, especially if we grip a lot with our upper abs through our ribs. So to be able to help us get motion and release through our breathing, what we can do is actually cup the front of our core. So I'm going to actually do this so you can see what I mean. I'm going to take the cup, I'm going to squeeze it onto my skin, and I can hold here. I can sort of move the tissue with it suctioned onto the suction cup to kind of move the skin underneath. So I'm moving mostly my the dermis of the skin, the actual skin layer, the connective tissue underneath, which includes some of that fascia. I can even, and I'm getting some good space here, I can start to kind of squeeze it again to see if I can get a little more tissue up in there. And then if I have enough lather or enough lotion, I can actually slide and glide this across to then pull tension out from this skin. So in the shower, I can really move this thing along my infrasternal angle to really help me get some movement here. I can do the same thing through my lower back. Okay, so as I stand, you'll kind of see where I can get here. I can squeeze this cup, and I can actually move this, and now you can see me actually moving it up and down that fascia layer of my lower back, right? So that's where I could even use my bigger cup. So these come in all sorts of sizes: large, small, extra large. This is a really big one that can be used on a pretty big surface area. I like to use this one on my IT bands and even up into my glutes a little bit in the shower. And then finally, I'll show you what this looks like on my calf. So again, putting a little bit of oil to just get things nice and slithery, we are going to apply. So this cup Where I like to put it is like right along those perineals. So I'll line it up so I squeeze it so it's more narrow along that bridge. And then I'm gonna slide across. If I feel any tender points, just like when I foam roll, if I feel a tender point, I'm gonna actually stick with that, hold it there. I might just breathe through that a little bit. It shouldn't be painful. Sometimes if I cannot even move the tissue slowly underneath the cup and the suction to let the muscle and tissue glide underneath that as this is held passively. So just some different options for how you can play with this to make it work for you. Again, give it a try consistently for a week or two and see what happens for you. Enjoy.